Good day everyone, I am Agatha Mamaril from BSN2C and I am here to perform Fundal height measurement, the Leopold'S maneuver, and the fetal heart auscultation. For the assessment, assess for the need of Leopold'S maneuver, assess the client's overall condition, and then determine when was the client last voided or last tested for urine analysis. Determine the client's age of gestation and the expected date of confinement. So, the client's last menstrual period is on May 9, 2022. So, we have 31 days for the month of May, minus 9 days, so that will be 22 days. For the month of June, we have 30 days. For the month of July, we have 31 days. For the month of August, we have 31 days also. For the month of September, we have 30 days, and today is October 10. All in all, that will be 154 days or 22 weeks age of gestation. For the expected date of confinement, the last menstrual period is on May 9, 2022, minus 3 months, plus 7 days, plus 1 year. That will be 5/9/2022, minus 3, plus 7, plus 1 year. So that will be 2/16/2023 or February 16, 2023, the expected date of confinement.
Magandang umaga po, ma'am.
Good morning.
For the implementation, check the physician's order and then introduce yourself and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can cooperate or participate. Ask the client to empty the bladder and then perform hand hygiene. For obtaining the Fundal height, position the patient in the dorsal recumbent position and then place a pillow under the client's head for comfort. Place a small towel or pillow under the client's right hip and then ask the client to be still with arms in the side. Drape the client with a draw sheet exposed from below the breast to the symphysis pubis. And then inspect the client for the following, such as the scars, skin lesions, or skin condition. And then determine the fundal height using the ulnar side of the palm. Measure the fundal height using a tape measure. Stretch the tape across the abdomen's contour to the top of the fundus along the midline. The client's Fundal height measured is at exactly 24 centimeters. For the Leopold'S maneuver, instruct the client to relax the abdominal muscle by bending the knee slightly and then do relaxation breathing. Reinforce the explanations given earlier. Use a flat palmar surface of the fingers and not the fingertips during palpation. And then keep fingers of hands together. Apply smooth and gentle deep pressure as firm as necessary. For the first maneuver, stand at the client's side and then face the client. Palpate the fundus using both hands. Curve the fingers around the uterus top and then feel for the fetal part lying in the fundus. Use the palm, palpate for the size, shape, consistency, and mobility of the fundus fetal part. If it is round and firm, it must be a fetal head. But if it's hollow, not so firm, it must be an extremities. Second maneuver, place your hands on the other side of the client's abdomen about midway between the symphysis pubis and the fundus. Move the hands on the sides of the abdomen. With one hand placed to steady the uterus. Use the other hand to palpate the uterus opposite side for firm circular motions. Repeat the maneuver of the other side of the abdomen. This is to palpate the fetal back. If it is smooth and firm, it must be a fetal back. We have to determine if the fetal back is lying on the right side or the left side. For the third maneuver, continue facing the client. Grasp the lower abdomen's portion immediately above the symphysis pubis, between the thumb and the middle finger of one of your hands. This is to determine the part of the fetus at the inlet and its mobility. For the fourth maneuver, face the client's feet and then place your hand's palmar surface on each side of the client's abdomen. Use both hands and palpate the fetal head using pressing downward gently with your fingertips about 2 inches above the inguinal ligament. This is to determine the fetal attitude and degree of the fetal extension into the pelvis. This is to palpate the fetal head if it is engaged or floating. Fetal heart rate. Place the bell side of the stethoscope's chest piece on the fetus convex portion, closest to the anterior uterine wall. Listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. For the evaluation and documentation, document the procedure including the test performed and resulted in the client's record using forms or checklists supplemented by narrative notes when appropriate. Notify the healthcare facility responsible regarding the results. Inform the client regarding the findings. And then teach the client how to proper follow up and provide other appropriate instructions.